Hello, I'm Dr. Ron Valdiserri, and I'm here at AIDS 2012 with my friend and colleague Tiffany West, who is the Chief of the Strategic Information Branch in the Washington, D.C. Health Department. How are you today,
I'm
Tiffany?
great, thank you, Dr. Valdiserri.
Well, we really appreciate your being with us. So, Tiffany, we're hearing a lot at this meeting about treatment as prevention. Can you explain to maybe some of the non-medical folks who might be watching this, why now? Why are we talking about that now?
There was a critically important study last summer that demonstrated that early treatment is very effective in reducing the risk and acquisition of HIV transmission amongst populations, and we think that today this is an important breakthrough for health departments to really focus on as we scale up our interventions.
Right. So not only is treatment good for someone who's infected because it makes them healthier, but what you're saying is now the science demonstrates that it can actually reduce the spread of new infections.
Absolutely, absolutely, and it's an important tool in our toolkit.
So let me ask you this, working at a very large health department in an area that has a lot of HIV, you must really appreciate the importance of bringing together prevention and treatment. In other words, in years past, we used to think about testing and diagnosis over here and treatment over there. Tell us what DC is doing to bring those two together.
What an important question. We look at our portfolio of programs along what we call the prevention to care continuum. You're right, in previous years we received funding from one federal agency that focuses on testing and other federal agencies that focused on care and treatment. However, with the National HIV/AIDS Strategy and the 12 Cities Initiative, we really tried to focus on diagnosis and then really linking people to care, ensuring that they were retained in care, and ensuring that people were virally suppressed with all of our resources, no matter who the funder.
And virally suppressed, what does that mean?
Viral suppression is a key cornerstone of our prevention and treatment strategy. When you're virally suppressed and you're living with HIV, you're much less likely to spread the infection to those who you may have relationships with. So as an organization, we're very focused on ensuring that all of our resources, whether it's prevention, care, or treatment dollars, are focused on ensuring that people are virally suppressed, that if they've fallen out of care, that they are re-engaged in care, and once they are diagnosed positive, that they're immediately linked to care.
So some viewers might be really surprised to learn that in the United States, on average, less than half of the people who are diagnosed with HIV, these are people who know they have HIV, that less than half are regularly in consistent medical care. Can you tell us from your experience in DC, what are some of the reasons for that, and more importantly, what are some of the activities that are taking place in DC to bring people back into care for their HIV?
Our research and just anecdotal conversations with both clients and clinicians really demonstrated that the reasons that people are lost to care or don't go to the doctor routinely is that, sometimes life just gets in the way. I think that we have developed strategic strategies in collaboration and partnership with our federally qualified health centers as well as our CBOs that really focus on what we call an active follow-up to clients who have fallen out of care. Recently, we conducted our own demonstration project called the Re-Engagement/Recapture Blitz that really looked at using the public health information system, our surveillance data, in collaboration with our clinical providers who they gave us lists of people and said, hey, we haven't seen these individuals in 6 months. We were able to then match that data to our system and said, please take 90 days, go out and do whatever you possibly can to ensure that those clients are brought back into care. The response was amazing. We were able to re-engage about 400 people who were previously lost to follow-up, and the response from the community was outstanding. When we went and knocked on doors, people were like, thank you. We didn't know that you were so concerned about our health, then I think that's a critically important aspect of the activities that we can do as the health department that really facilitates collaboration and coordination with our funded grants.
So let me say, what do you think, how can various community organizations, we know what health departments can do. I think we understand what doctors and nurses and social workers can do. But what do you think the community organization, whether we're talking about faith-based or sororities, fraternities, social organizations, what can they do to help us move forward with all of this work?
I think it's a transformative time in our response to the HIV epidemic. When we release our data, the question that we receive most is, what is the health department doing to reduce HIV transmission? And we can't do it alone. I think that both faith-based organizations and other traditional organizations really can facilitate an important dialogue that needs to happen in this country around HIV, to destigmatize HIV as just another chronic condition for which treatment is available. I think our CBOs can really refocus their efforts from what they have been traditionally doing to really focusing on how are we ensuring that people are linked to care, how are we ensuring that they stay in care, and then how are we ensuring that they are reaching and maintaining the optimal health outcomes that we all need to be implemented to fight this really critical battle.
Thank you so much for that wisdom. Tiffany West, my colleague from the DC Department of Health, who's doing great work to keep the citizens of DC healthy.
Thank you.
Thank you, Tiffany. So thank you for listening to us. This is Dr. Ron Valdiserri reporting from the 19th International AIDS Conference here in Washington, DC.